My name is Nanda Pitchcat. I'm a PA. I work down in Macon, Georgia. I've been working in neurosurgery about 18 years now. I've been a PA for about 27 years. And I've been working with the folks here at MIRIS and using some of their spine system implants. And I'm going to give you a little information session on their CYGNUS system, which is the cervical plating system. So let's get started. When CYGNUS first came out, they have the lowest profile and the narrowest plate that's available on the market. And they have a variety of single level all the way up to 4-level plates that are available. And with its narrow profile, that serves several advantages that I'll mention as we go through the talk. Basically, they have all the instruments available. I don't necessarily myself use them all, but again, everything is available within what they have. Again, you do your standard discectomy on your ACDF. Then within the trials, they have a variety of trials that are available, and they have a couple of updated modifications. But basically, the first generation, which are the ones that I use, basically they have a variety of 6-degree and 10-degree lordotic trials, and these go all the way from 5 up to 10 millimeters. They've recently come out with more of a lollipop style driver that's color coded, so that gives a little bit more flexibility. Within the cages, once one has decided the trial size, then they have their traditional peak, as well as they've recently come out with the 3D titanium cages, which right now are titanium laced. Down the road, hopefully they'll be able to see about incorporating some of the more technology within that. So that offers one more option there. Once you've decided on the size of your trial, decide to go with the PEEK or the 3D titanium, of course they have the traditional holder, screws onto the implant, that can be tapped in place with the mallet. It unscrews off. And then if for some reason you need to get some additional tamping, they have a low profile tamp that's available to use. Once you've placed your cage, then of course you want to go for a plate placement. And again, as I said, there's a variety of single level, host of sizes, which I won't go into. But again, with a rep availability, you kind of have a feel for what size you want. Once you get the size plate that you're planning to use, you can then place it, of course, in the wound. And then, depending on surgeon preference, they do have available, there's drill guides as well as drills. Now, all of the screws that are built into their system are self-tapping. So I personally, the surgeon with whom I work with, and again, my preference is not to use any drills. But again, that's purely preferential driven. But again, you have standard drill guide that fits on top of the plate. And then you have the drill, goes in there and it's set. And they have that drill available, 10 to 16 millimeter availability. If you're used to using a owl punch, they have that available as well. If you want to just break the cortex, standard fits on top of the plate. And then again, you'll get a little break in the cortex. And then again, as I said, with self-tapping screws, my experience has been just with using the screwdriver and placing the screw alone, that's sufficient. Then we have the screwdrivers. They have a couple of generations that they've developed. The first generation was just your traditional torque screwdriver. But what they have now that's currently available is they have a sleeve that fits over the screw, so that holds it in place. So you have your traditional star torque, then you have this sleeve that holds it, and this keeps it in place. Some of the earlier editions they had was just the standard star or torque end. Then they modified it with a slot in which held the screw a little bit better. But currently this seems to be the best modification that's currently available. Then again, as you go to place the screw, again, one thing to keep in mind with this system, because of the narrowness of the profile of the plate, these screws are divergent, so they can actually be placed perpendicular. You do have angularity because, of course, they have variable angle screws. So you have the latitude to angulate them up or down as you see fit, depending on where in the plate you are. And you don't have to worry about just doing traditional medial convergence, as is typically the case with most traditional plating systems. With this design, once you have the screw in and you have it to a certain point, you can lift up on the cap and then finish inserting it, and then pull it off, and then go on to your next. One other thing I wanted to show, which I think is also something that they had to uniquely address because of the nature of the plate, they had to make a very unique plate bender. So again, with the Moore technology, these plates are, of course, very hard and they're very rigid. So the threshold is going to be much narrower. So traditional plate benders, again, were not always the answer. So after having made a couple of modifications, we tried the traditional hand benders. Those had some issues. They came out with the bender that I have in my hand. They actually had to make a couple more modifications to account for the screw hole cover. So as you can see, with the modifications that they made, you can get quite a bit of lordosis accomplished on these plates. And again, frequently 2 levels you may not need, but again, if you're talking about having to do 3 and 4 levels, you can see that quite a bit of lordosis can be accomplished. One other thing that I didn't cover too, with the plating system, the same driver is what's used for the locking mechanism. Oops. So after the screws have been placed, you'll see there's a brass colored cover. That same screw driver fits in it, and it will turn to the right almost 90 degrees, and then there will be some ends on that cover which will then sit on top of the screw, and then that will hold and lock it in place. And again, the beauty of the system, you have one driver, one end, same end will work for the screws, same one will work for the locking mechanism. Within their screw profile, you have variable, self-drilling, self-tapping. The standard screw is 3.75. It does go up to a 4.25, which is essentially the rescue. That's also available in variable and fixed. And I think that pretty much covers the overview of the CYGNUS system. This segment will cover the standard technique for utilization of the mirror CYGNUS cervical system. After standard anterior cervical discectomy has been performed and end plates and anterior vertebral bodies have been prepared to the surgeon's satisfaction, we'll next use a trial to determine this inner body cage. There's a variety of 6-degree and 10-degree lordotic trial spacers. For our purposes, we'll be using 7mm 6-degree lordotic cage. The cage is then prepared, attached to the inserter and tapped in. And this turn screws off of the cage. Then we'll apply the anterior plate. Again, we've already prepared everything as far as the anterior surface. Osteophytes have already been removed here. So you'll notice the narrow profile of the cervical plate, as well as the fact that with the hourglass design, you have good visualization of the cage and you can line it up in the midline. Once you have it in position, there's a variety of screws that are available. For our purposes, I'll be using a variable screw, 14mm screw. These are 3.75 screws. And one nuance is you can basically apply these perpendicular instead of directing them medially, as most are usually used to doing. These are self-tapping screws. Just to break the cortex to get it going. Okay. Then you have the locking screwdriver. There's 2 plates that cover the screws. with slight 90-degree turn for both the superior and the inferior screws. And that completes the instrumentation utilization of the CYGNUS system.